Welcome back. About 2 to 3 million Americans take anticoagulants or blood thinners every year for a number of medical reasons. And some aren't fully aware of the major risks that come with side effects of this certain type of medication. They can be the best line of defense for people with a higher risk of strokes, heart attacks, or blood clots. And while it may be just what the doctor ordered, blood thinners create a serious side effect most people don't realize they have until the unexpected happens.
Anytime we're cut, our body has a natural mechanism to cause that blood to clot, and when we give you a blood thinner, that mechanism is impeded, so it's going to cause you to bleed excessively.
United Regional's Trauma Medical Director Brett May says blood thinners are often prescribed to older patients with a history of heart conditions, which can land them in an even more dangerous situation if they fall and get hurt.
As we age, things change with our bodies. My mom, her skin is thinning. If she bumps it, she bruises, she bleeds easier. So obviously, if you're taking a blood thinner, that's going to be even worse.
And when it comes to a bump on the head,
we can have some movement of the brain inside the skull. And what happens is we have little tiny veins that bridge between our brain and the skull. And as our brain shrinks, those get stretched. And just a little bit of movement can tear those vessels. So even minor falls or minor injuries can result in significant brain injuries with patients on blood thinners, so you have to be aware of that.
In the trauma unit at United Regional, protocols on injuries such as these have been boosted to help treat more patients who are taking blood thinners as quick and effective as possible.
We've now instituted a process that if we have a patient that's older than 65 on blood thinners and they fall, then we partially activate our trauma team so that we get them evaluated quickly, because again, they could have internal bleeding and not really even have any symptoms. So those patients will undergo a very rapid CT scan and neurologic evaluation.
Dr. May also points out blood thinners are not limited to older adults.
I've actually been on a blood thinner. I injured my leg and had surgery and developed a small blood clot, so they put me on a blood thinner for about 3 months.
Even though blood thinners come with excessive bleeding, they do save lives, which is why Dr. May encourages patients, both young and old, to do the following.
They always keep a list of their medications with them, that they always review those medications regularly with their doctor. And if you're younger, make sure that you need to stay on that medication, because a lot of times we have patients come in that have suffered trauma that are still on a blood thinner that didn't need to stay on that blood thinner, and that just complicated their injury and their hospital course.
And in the event of a fall or injury while you're home alone and you're taking blood thinners, Dr. May recommends that you stay calm and try not to move too much. Find something close to you to apply pressure if you do have an open wound to stop the bleeding, and immediately call 911. For more information on blood thinners, find this healthy use story over on Texomashomepage.com.